go. Well, hello. We have Cindy here, a really lovely, lovely person. And we are going to be doing a testimonial. I just want to ask you a few questions just about your journey, your health journey over the last few years. And just start with who Cindy is. So tell me, who is Cindy?
Well, I'm 53 years old. I live in Pennsylvania. I have two kids, both in college, and I've been a patient for a few years now, and a very, very happy patient.
Wonderful. Good to hear. And so I am curious, what was the major health concern or health concerns that really brought you to see us?
So I was diagnosed with retroperitoneal liposarcoma in both 2018 and 2020. So I had surgery in 2018, and just before my second diagnosis, I was made aware of Dr. Nasha's program. And I came to you because initially it was simply because you were the clinic closest to Pennsylvania. And I was thinking that I would be traveling. So I chose this clinic, not realizing what a perfect fit it was.
Wonderful. Well, that's always good. Proximity is key. And I think I remember we started together around the time of the pandemic. So sounds like telehealth was a perfect fit during that time as well.
Yeah. And honestly, we've been remote ever since, and I have not seen one problem with that whatsoever. It's worked out perfectly.
Good, good. And so I guess before we started working together and before or maybe around the time that you started with like the metabolic approach, Dr. Nasha's program, what things did you try to support this diagnosis?
Well, I did have the surgery in 2018, and I actually did travel to California. There was a facility out there that was a cancer facility that it was like a naturopathic kind of treatments as well. And I did venture out there for a bit, only once actually, but that was about it. As far as anything else, I changed my diet a little bit and had the surgery, and that was about the only changes I made before I saw you.
Okay. So went out to that facility in California. Were there any certain kind of methods or treatments that they used or that you did?
Yeah, so when I went out there, I didn't realize they have no less than 17 additional add-on treatments in addition to a diet and nutritional type of plan. There wasn't really a methodology or a theory or a book that you could read to understand the reasons why they were directing you certain ways. So when I went out there, I did a couple treatments, a couple for maybe emotional release, and then another one that I actually, it was more like um, energy, kind of energy healing. But I did find that that facility was overwhelming, first of all, because there was almost too much, and I didn't understand any of them, and I didn't really get much of an explanation. And even when I went back, since there wasn't a book and there wasn't anything for me to read, I felt like I was very much tied to whatever it was they directed me to, rather than it was very disempowering. I didn't feel like I had any control over what was being directed to me, and I didn't understand the reasons why. So for me, it was not a good fit at all. And it only lasted one visit, and I was like, this is just not going to work for me.
Yeah, that definitely makes a lot of sense. And I could imagine that many kind of add-on therapies could seem overwhelming if there is no kind of education around it, it sounds like.
Exactly.
Okay. And so it sounds like you found Dr. Nasha's work, Metabolic Approach to Cancer. And was that how you found us? Is that right?
Yes, a friend of a friend had heard Dr. Nasha on a podcast, and she had recently been diagnosed with liver She had a liver cancer diagnosis. But she actually traveled to New Mexico and spent like tens of thousands of dollars and was kind of tied to whatever program that was. But she had said to me, if I didn't do that, I would have most definitely gone with Dr. Nasha. So when I went to Dr. Nasha's website, I saw that there were participating clinics. And that's when because of the California trip, I didn't want anything that was going to be cross country. So I was looking for something as close as possible, assuming that I would have to go in person. And as it turned out, I didn't even have to, which was great. So it was just a win-win all around.
Wonderful. Okay, so you found us through Nasha, super close to you, it sounds like. And during that first visit, what really stood out for you?
Well, for me, it was definitely that it didn't feel like a factory. Like I did feel like in the California facility, I was almost like just a number. You could see there were so many patients in there, and they were kind of just shuffling in. And the doctor that I met, I just could tell that there's no way she'd remember my name. There's just no way she would understand. It didn't feel personal at all. So, and also because there was no book or any sort of theory for me to read about to understand where they were coming from. That stood out to me a lot when I read Dr. Nasha's book. I felt like I really did not have to rely solely on what you were telling me. I could actually understand the reasons why you were saying what you were saying. And, I could really feel like I was in more control of what was happening.
Oh, so good. Resources sounds like that's the key, right?
For me, yeah.
Perfect. Oh, wonderful. And so with that first visit, and you again, you kind of touched on it with not feeling like you were just a number and you were actually Cindy to us.
Right.
Were there any other things that really stood out compared with other practitioners, whether conventional, holistic, otherwise?
Um, I mean, there was just so much more information that, obviously with conventional practitioners, it's night and day. You can't compare a conventional practitioner with your facility because, um, I never really felt like I had any, I didn't have a doctor that really wanted to hear what I had to say. If I had any, even if it was like a vitamin C IV, like they just looked at me like I was from Mars. Like I could not communicate with them about anything alternative whatsoever, anything regarding diet, or any sort of vitamin mineral deficiency. They don't even understand what that means. So this was really a really good match because I was already looking into health and wellness and looking into alternative ways even before my diagnosis. So this really matched in almost every single way. It was perfect.
Wonderful. Well, that makes me very happy to hear. And fortunately, I know not everything works out perfectly. There's always bumps in the road. So would you like to kind of expand off any kind of obstacles you had, hiccups in, your work that may have prevented you from continuing with us?
So yeah, within the first month or two, um, there were, I think, some supplements that I ended up taking that weren't the best match for me, and I did go into a cytokine storm, which was scary and it was frustrating. I remember being very frustrated because you try so hard and for things to work the opposite way, it was just very sad. Um, but um, but it was short lived. And, I did feel like um, I still had faith in the methodology. I've had faith in you and your direction. So it was just a matter of time waiting for that little bump in the road to clear. And then from then on, I haven't had anything at all that is moving in the wrong direction. So for me, it did work out well.
Okay, good. And I guess with that, why did you decide to continue working, despite the big cytokine storm, this major or minor bump that you had?
Well, definitely having read Dr. Nasha's book, I believed in the approach. I was very comfortable even after this whole thing happened, with your delivery and how calm you were and how informative you were and how confident you were. I mean, it really made me feel comfortable knowing that the guidance you were giving me was, the right direction. So I just had faith in it and continued power through it.
Wonderful. Perfect. And how has your life changed since starting and since really kind of moving in this approach?
So it's changed a lot. Obviously, I was cleaning up a lot of physical health concerns that I had, even aside from my diagnosis. I had a lot of other issues like bloating and constipation and melasma and eczema. I had a lot of things that literally just disappeared after following the program, um, let alone with my diagnosis, staying at bay. But so, yeah, I've never felt more empowered. I've never felt more inspired. I had this sense of purpose now because I'm now participating in Dr. Nasha's advocacy program. So I can help other patients. And that really gave me a sense of direction in life and really helped me stay on track and feel motivated to continue. It's been great.
Good, wonderful. Well, yes, we definitely need more advocates. So continue on that good work because it's so needed.
Right.
Wonderful. And last couple questions here. So, with everything that you've experienced, what has surprised you the most about our practice and the way that we work?
Well, the first thing I would say is just how easy it is to work remotely. I think I did not expect that. I did expect to have to travel, and that was seamless. So that was a great surprise. And I think just not realizing that Dr. Aaron was one of the first doctors that worked with Dr. Nasha and learned her. I had no idea that I chose one of the first clinics. So that made me feel so much more confident too, because I knew she had more experience than any of the other ones that I would have contacted. So that was great.
Wonderful. And lastly, what are kind of the main reasons, the main points of why you'd recommend us to anybody else?
Um, First and foremost, it's definitely because you are following Dr. Nasha's methodology. And I do feel like, although it's, geared towards cancer patients, you could certainly argue that methodology would work for patients that aren't even with a cancer diagnosis. So I do feel like that's the most cutting edge cancer research to date. And I do think it's very, very easy to work not just remotely, but just work with you directly because of the way that you um, deliver your guidance and your information. I do feel like that is very important. You don't want to feel patronized and you don't want to feel unsupported. You don't want to feel like you don't really have the support of the doctor behind you. So I think that and just how gentle but informative you are, I think the combination works out perfectly.
Wonderful. Well, there you have it. Thank you, Cindy, for your time. This was really wonderful. And yes, you're such an amazing person to work with. And I will be seeing you soon.
Sounds great.
Take care.
Thanks. You too. Bye bye.
Bye.